Audible? Am I audible? 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 आ रहा है? Audible? Am I audible? Okay, fine. Hello, friends. Good evening. Very good evening to all of you. I'm Dr. Aishvarya Kaushik, your original guru and faculty for conservative dentistry, endodontics, and dental materials at DBMCI MDS. Now, guys, today evening, well, today is a Sunday evening, right? And yeah, hi, good evening, everyone. And we're waiting for the US Open final, right, between Yannick Sinner and Taylor Fritz. And wow, good to see that all of you are active, up and about, active on a Sunday evening. So, guys, today I'm going to be discussing the most important topics for conservative dentistry and endodontics for the upcoming INI examination. INI CET MDS examination that usually takes place in November, and we are going to be discussing about conservative dentistry and endodontics. Now, first of all, guys, never ever, when you're dealing with cons and endo, usually, we end up relying more on endo and less on cons. So first of all, keep in mind that cons is, if not, I mean, conceptually, of course, equally important, but in terms of weightage of the questions, yes, relatively less important than endo. Endo has got more topics, right? The good thing and the bad thing about cons is that we don't go very deep into understanding the subject and the topics. If you see the original Sturdivant, extensive discussions ranging from conventional preps, amalgam, direct filling gold, inlay, cast metal inlay, onlay, and going on to the recent materials like composite and GIC preps. So the syllabus is huge, right? Even in cons, right? So that's obviously not a good thing. But the good thing is that the examiner is not really, delving deep into this aspect, and primarily from the examination perspective, they've divided this entire topic of cons. If I'm to analyze the previous year's INI paper especially, and of course NEET paper as well, they're interlinked. The examiners who make these papers are more or less common. So if I'm to interlink, and I see the conservative paper, fundamentals of tooth prep, isolation, karyology, that is all on one hand. Armamentarium, operative armamentarium, that's instrumentarium on one hand, and the other is all types of tooth prep. And usually, tooth preparation specifically, they're not going too much into the detail. Now, this does not mean that we don't study this well. This basically means that, study it but generalize it and make a comparative analysis. Like, for example, you have to memorize, what was the differences between, say, a class 1 amalgam versus a direct filling gold versus a composite preparation, right? What are the different types of composite preps? Conventional, B-weld, conventional, modified, etc. and etc. Right? So this all types of tooth prep, which is actually a big chunk of conservative dentistry, has to be kind of summarized and kept in your head in a separate compartment, right? Equally important is these specific chapters, which are not as much in volume as compared to the rest of the syllabus, but they're much more frequently asked in terms of weightage as far as questions are concerned. For example, as recently as this year's INI, fundamentals, from the chapter of principles of fundamentals of tooth prep, they would ask you a question in which they would want you to know what is the difference between a simple prep versus a compound prep versus a complex prep, right? So one surface involved, two surfaces involved, more than two surfaces involved. You should know this. You should know this, right? As simple as pit and fissure sealants. For example, from the topic of karyology, you should know the indications and contraindications of a pit and fissure sealant, right? Basics, right? From karyology, incipient caries, critical pH. Well, controversial questions. Incipient caries, when do you see it? Do you see it right at the critical pH, that's 5.5, or do you see it slightly below? The answer is 5, right? So it's the same things again and again, the basics, the fundamentals which have to be, repeatedly revised. Isolation. They would give you an image-based question. It happened last year. They would give you an image-based question in which they would be giving you a rubber dam clamp, right? And it would be either a winged clamp or it would be a wingless, or it would be a wingless clamp. So you should know which is what, and you should be able to answer this question. So conservative dentistry is, don't bypass it in favor of spending more and more time on endodontics, right? You will have questions from cons, guys, right? And I think we're just slightly lucky, and I don't know when that inflection point, when that period is going to come, wherein they are going to start asking questions from detailed questions from tooth prep also. And those of you who've been taking our classes, seeing our videos, all of you know I spend a significant amount of time in, taking lectures and doing videos on the various types of tooth preps, right? And, conservative dentistry is very much closely linked with dental materials. For example, if you're dealing with direct filling gold, the preparation part as well as the material part, they're very closely linked, right? And then again, operative armamentarium, one of the favorites, right? One or two questions are always there from operative armamentarium. The classification of your chisels and excavators. What is a bi-beveled hatchet? Is it a chisel or is it an excavator? Right? What is an enamel hatchet? Is it a chisel or an excavator? Revise it, memorize it before going into the examination, guys, right? And of course, we at DBMCI have different ways. Like we have detailed videos, then we have compressed videos with rapid revision, then we have test and discussion, so many things. So guys, keep doing your last 5 years papers, of course 10 years papers, but looking at the examination from, say, a perspective of 3 weeks, 4 weeks, when you're in, say, somewhere in the first week, second week of October, just concentrate on the last 5-year papers, right? And then, as I said, all types of tooth preparation, that's a huge, chunk of syllabus. You need to revise it again and again and just summarize it and keep it in your head, right? As you know, in all my videos, I try to generalize things so that it becomes relatively easy for you to memorize and put them together in a compartment, right? Next up, endo, right, guys? Now, endo, each and every chapter has got very many MCQs. As far as I&I examination is concerned, traumatology, that stands out, isn't it? So traumatology, I mean, everything else of endo on one hand and traumatology on the other hand, right? There's some specific, you can say, love affair of, the AIMS people with traumatology. Well, be that as it may, I mean, we have to accept that fact, and we have to understand and accept the fact that, there are very high chances that in every I&I examination, at least in the coming, few years, or at least few 2-3 examinations, till we see a significant change in trend, this trend is continuing since the past 4-5 years, right? Now, in traumatology, you're supposed to, one of their favorite questions is the management of open apex, right? And they would give you both, MTA, apexification, and regenerative options, right? So guys, the case selection on this is going to depend on what classification of Schweck's classification the open apex tooth falls under, which I have discussed a couple of times, multiple times in the morning motivation also, right? So you need to know that classification, right, guys? That when you talk of Schweck's classification of open apex cases, guys, then dealing with, say, a type 1, 2, 3, 4, and 5. So type 1 would be, the root length is less than half of what it would be, and that comparison would be the adjacent tooth, right? Adjacent, similar, same tooth of the opposite arch. So if it's the lateral incisor of the first quadrant, the lateral incisor of the second quadrant, right? Central incisor of the first quadrant and central incisor of the second quadrant. So it would be less than half. Type 2 would be equal to half. 3 would be about 2/3. 4 would be almost the same length but still an open apex, and 5 is of course a mature apex, right? So in 1, 2, and 3 you're definitely going for a regenerative procedure. Type 4 you can go for either, right? So I mean, as I said, endo is all about controversial questions. Management of root fractures. Previous Anderson writes 2 to 4 months. Presently, Cohen writes 2 to 4 weeks, simple. So if you have an option which is saying semi-rigid splinting for 2 to 4 weeks, you have to go for it, irrespective, even if it's a coronal third fracture. Latest Cohen does not differentiate between the level of fracture. It simply says that, yes, a coronal fracture in which the fracture line is at or coronal to the alveolar crest, it's unsupported, the coronal fragment is unsupported, reapproximation would be tough, so the prognosis is extremely poor. But that does not mean that you're going to go ahead with rigid splinting. All about these controversies. Traumatology is full of it. Most common form of root resorption following an avulsion injury. Replacement resorption or inflammatory root resorption? Answer is inflammatory. Yes, replacement resorption, ankylosis does take place, but it is always preceded with inflammatory root resorption. And you cannot stay in conflict with that one golden line, that the most common type of root resorption following any type of traumatic dental injury is an inflammatory root resorption. And avulsion is a type of traumatic dental injury, right? So I mean, full of controversies traumatology is. You just stick to what we say, because when I take your lectures, I see all the additions, right? Possibly all the possible answers that can be, and I try to give you a summary. So I mean, we try to give as with a lot of research at our end, we try to give as precise and as correct an answer as possible, but then of course we never know what is there in store as far as the examiner is concerned with the key, right? But these are the things that you have to stress on before going to the examination. Yes, equally important is the fact that please don't mark the repeat questions and the simple ones wrong, right? So that is one set of an issue. That is one issue that has to be crystal clear, right? I mean, I'm talking of these controversial questions. I mean, forget about these for the time being. Please, if you want to stand a chance at getting a rank, you have to do your repeat questions, non-controversial repeat questions correct, and then comes and then comes the next step of managing these questions, right? Another question, I mean, a false negative response to vitality testing or a pulpal sensitivity testing following a traumatic dental injury can occur up to how many months? Now, the recent IADT guideline says several months. Why several? Because in one paragraph of Cohen, it's written it might take 9 months. Somewhere it's written it might take 1 year. So that's 12 months. So several months is the best answer as far as IADT recent guidelines is concerned. But only if it is there in the options. If several months is not there in the options, then the second best answer is 3 months. Because that's IADT previous guidelines. And the third best option is 2 months, because that's written in Anderson, right? So I mean, guys, that's the thing here. These are the questions which are having multiple correct answers, but you have to mark that one answer. So you have to follow that protocol, right? If I were you and I was sitting for the examination for that specific question in which he's asking you that false negative response to a traumatic dental injury would occur up to? The first answer would be several months. Second answer would be 3 months. Third best answer would be 2 months, right? So guys, traumatology, traumatology, traumatology. Apart from that, diagnosis in endodontics. You know, your innervation, A delta fibers, C fibers, which are the proprioceptors in the dental pulp. Is it A alpha or is it A beta? Right? I continuously do these questions so that they get stamped in your head, right? In our GTs, in our TNDs, I always do this, and I always revise them during my videos with you. So diagnosis is very important. Patient is sitting in the OPD with a cold jar against his face. What is the diagnosis? Is it pulpal necrosis? Is it irreversible pulpitis? Right? So all of these things are extremely important, guys. From diagnosis, we move on to tooth morphology. Be rest assured that one question from Vertucci classification will definitely be asked. I mean, that's one given. It's always asked in both I&I and NEET. So type 1 to 8, memorize it by heart. I do it in every video. So revise this, right? Then we move on to working length. You can get an image-based question, right? They would show you an apex locator and they would ask you what is it used for. Then, of course, we have another controversial question, the zero reading of the apex locator. This is a free YouTube session, I think, for everyone. So I'm not going to tell you the answer to that, but you get my idea, right? All of you, please revise these things. Then we have what? Cleaning and shaping. Oh, extremely important. And along with cleaning and shaping, guys, please do the applied part, that is iatrogenic errors. And how do you prevent them? And how do you manage them? So, for example, the different types of apical transportations, type 1, 2, and 3. How do you manage a type 1, if at all any specific management is required? How do you manage a type 2 apical transportation or an apical zip? How do you manage a type 3 apical transportation or an apical zip, right? Cleaning and shaping, which is the best technique to prevent periapical extrusion of debris? Which is the best technique to prevent iatrogenic errors? Is it the balanced force? Is it the crown down? Right? Then you can get image-based questions. Image-based questions based on a diagram of sequential diagram 1, 2, 3, 4 depicting the balanced force technique. You can get an image-based question based on anti-curvature filing. Right? So all of these things are important. Then we move on to obturation. Obturation, yes. Alpha type gutta percha and beta type gutta percha. What are the differences? Techniques of obturation, usually the question is, I've not seen that question since the past 2-3 years, but I would recommend do revise it. Do revise it. Obturation, don't spend too much time, but do revise it. Right, guys? Traumatology, extremely important. Iatrogenic errors, extremely important. Then bleaching. Bleaching is extremely important. You'll get small chapter, you'll get various questions like, what is the treatment of choice for managing a tetracycline stain as far as bleaching is concerned, right? Number one. What is the alternative to bleaching, microabrasion, etc.? After how much time should you do a composite restoration once the bleaching treatment is finished? Again, a great controversial question, right? Is it 1 week? Is it 2 to 3 weeks? Is it 1 to 3 weeks? Right. So, guys, again, I'm not revealing the full answers here because, I just want you to revise this. And as I said, in our videos at DBMCI MDS, we keep doing this. Endoperio lesions, yes, a small topic, but again, questions do come. For example, there's a very favorite question of the examiner in which there is a draining abscess through the gingival sulcus, right? Is it a primary endo lesion? It's a primary endo or a secondary perio, and so on and so forth. That's a favorite question of the examiner. From cracks and fractures, what kind of probe should you be using to determine, is it a flexible plastic probe, is it a stiff stainless steel probe to determine vertical root fracture? What is the treatment of choice for a cracked tooth syndrome, right? How do you diagnose a cracked tooth syndrome? You can get an image-based question with a tooth sleuth or an orange wood stick, right, friends? So all these things are, extremely important going into the examination, right? What else is asked from our topics here? Um, yes, big controversy, configuration factor, C factor, right, in operative dentistry, right? I've taken a lot of efforts by referring to different textbooks, and I've shared that with you in your morning motivation session, guys. So, you know, you guys have the edge. You guys who've been taking classes from us have the edge as far as the correct answer to these controversial questions are concerned. Stick to your guns, believe in yourself, and it's like 1.5 months now, practically, for all practical purposes, right? I'm not saying 2 months, 2 full months, 1.5 months. As you can do it. I mean, um, it's a very common tendency, isn't it, for all of us to, for instance, when I used to give my competitive examinations, the MDS entrance examinations, and I cracked it in 2011, I used to, whenever I was slightly stressed, I used to imagine the map of India, right? And I would think that there are hardly 120, 130, 140 seats, all India. How many students are there? What a big country are we, right? But I mean, you can only do what you can do, right? So do that well. I always tell myself, even while I'm practicing in my clinic, I'm doing my I'm doing my endo cases. Irrespective of how tough the situation is, how tough the case is, I just tell myself that I can only do what I can do, right? But that has to be done in the best possible manner. I try to follow all the standard operating procedures. I try to isolate my case, irrespective of whether it's a retreatment case, upper 7, lower 8, lower 7. I try to isolate it with my rubber dam. You have to do it. So similarly, I mean, don't get hassled by the enormity of the situation, how tough it is. I mean, these are the things that you're supposed to do. I've told you, right? And this is the same for all the subjects. All the subjects will have standard questions, will have some tough topics in which you will need repeated revision for them to stick into your head, and there will be some controversial questions. And you'll need to figure out a way of reaching that one final answer of that controversial question, right? I do that for DM cons and endo, and I'm sure other subjects or other subject teachers are also doing that for you. Keep doing that. Keep doing the same things again and again. There's a lot of monotony. But ultimately, you get better only when you keep doing the same things again and again. At your level, keep revising the same things again and again and again and again. Right? So going to your dinner, in your mess, having your food, in the back of your head, continuously revise the fact that a bi-beveled hatchet is falling under excavator. It's not a chisel, right? A bi-beveled hatchet, an enamel hatchet is a chisel, but a bi-beveled hatchet is an ordinary hatchet, and it's an excavator. You understand? So these things, if you keep on doing them in your head again and again, then you don't forget, then you don't get confused in the examination, right? And another very important thing I always tell you, when you have these tough questions, see the question, read the question first, figure out whatever relevant theory that is supposed to be highlighting in your head, right? Because you're going into the examination having the data of 19 subjects. If you see a question that is from a particular subject, first see the question, don't see the options. See the question, get into the zone of that subject, then get into the zone of that chapter. right? It'll take some time. It'll take 1 minute. It'll take 1.5 minutes. So be it. There's always adequate time. You'll never fall short of time. I mean, if your reading speed is okay, you don't need to be a extremely fast reader. So get into the zone of that topic. Get into the zone of that subtopic. Think about the relevant theory. Reach the correct answer in your head, and then see the option and mark the most appropriate one. That's the technique of minimizing your negatives, guys. Right? So I mean, these techniques are universally applied across all the 19 subjects, whether you're preparing for MDS or MD or MS, right? Or your PMTs. That's the way to do it to crack your competitive exams, guys. And cons and endo, yes, you will get image-based questions. You will get questions right across various topics, starting from the karyology, the first few chapters of Sturdivant, right? From fundamentals of tooth preparation to karyology to traumatology of endodontics. So it's a huge spectrum to cover. But beta, no, Aparajita, you don't read to see. You have to refer the textbook. You have to refer the textbook, guys. I mean, for example, how do you bypass a ledge? Big controversy going on there. Is it 3 to 4 mm bending of the end of the file tip, or is it 1 to 2 mm, or is it 2 to 3 mm? At what angle? Is it 45 degrees? Is it a distinct curve? Again, I would say that I'm not going to tell you the answer here because this is more of a discussion of the topics, right? But you get the idea, right? All you DBMCI MDS students, we've done this in the morning motivation. So guys, you just have to refer the textbook for controversial topics, for things that you keep forgetting again and again. Keep doing MCQs, keep seeing our videos, keep referring to our notes, and whatever additional thing that you feel is, some relevant theory. Because what happens is when you refer your textbook, guys, the theory becomes a part of a story, right? And it's easier to remember a short story, right, than to remember facts. So it's always good to have a good solid background of textbook. But when you're looking at the examination 1.5 to 2 months from now, I mean, you cannot read the entire chapters from textbooks. You can just refer to the textbook to that particular page. If you want to read about balanced force technique, just go to that page of Cohen. See, revise the diagram, revise that one paragraph written about balanced force technique, cement that concept in your head. You already have an idea. You already know it. Cement that, weave it into a story, right? That okay, this is how it happened, and these are all the related MCQs that can come, and that's it, right? So guys, that's the approach. These are the topics, and not just for cons, endo, and DM, but whatever general principles of approaching your paper, having the right attitude, and just keep revising these things again and again. Keep the faith, believe in yourself, keep taking your God's name, and I think we should be doing good, right, guys? Great. So guys, it's always wonderful interacting with you live, and of course I'll stay connected with all of you, right? Anything else? I think I've covered all the important topics that are there to be covered as far as your cons and endo is concerned. Local anesthesia, yes, you do that in oral surgery. There's an endo perspective also. How much time does it take for pulpal anesthesia to be, effective after an inferior alveolar nerve block? Right? 10 to 15 minutes. Controversial question, but that's the answer, right? And regenerative endodontics, I told you that would be a clinical based question. Iatrogenic errors always has to be done in combination with cleaning and shaping, right? Management of hypochlorite accident. How far do you need to keep your side vented needle from the working length so as to ensure that you don't extrude hypochlorite into the periapical tissues. Same for open-ended needle. I've discussed this again and again in your classes, in your morning motivation. So guys, all these, I think we have been right up to it in trying to address all the controversies as well as the standard questions. So guys, keep going strong. Beta dental materials session we're going to have on another day, right? So I'm going to be talking of dental materials, Kanishka, in another session, right? Great, guys. So fine, it's a Sunday. Go and have your ice cream and keep studying hard, guys, and keep the faith. Thank you, guys. Take care.